Welcome back. In today's video, we're going to talk over the new inbox layout. In this specific video, we're going to go ahead and just address the first tab, clinical tasking. And I want to start off by pointing out this top left configuration wheel. And this is where you can come to go ahead and check off, show completed tasks, removed ones, or tasks that you had assigned to someone else. And that will then change what you view here within your tasking grid. And you can always go back here to then unclick. Another area that would be important is workflow delegates. And this is where you're going to come in to add users in. For example, Dr. Anderson, if I wanted to add him in to my grid so that he can always have access to my provider approval queue, or if I only wanted him to have access when I'm out of the office, I'd then highlight his name and drop him down. Or I can always just remove people that I don't want to have access to my pack. And then you would come to workflow to then give people access to your clinical tasking when you're out of the office, or if you always want them to have access to your workflow. From there, I just want to point out that this left-sided section here is just going to show you your appointment grid, which will also be found up here in the appointments tab. And then to the right side over here, you can get quick views of active medications, their most recent diagnoses, any problems a patient may had, and a couple of patient identifiers here as well. And then one of the more important screens or sections is here down below is where you'll find all of your functions. And this is where you can go ahead and reassign tasks or enter this specific patient's chart by hitting chart. You can reply, complete, remove tasks. And then I'd briefly like to cover that you can create new tasks from within this screen. And you don't have to assign anyone a task. You can actually just write in your title up here. And then a little comment to yourself. Go ahead up here to look up patient that you want to associate this task with, and then click send task, and it'll just keep it up here for you. Or if you want to go ahead and jump into the recipients and then pick off a user or group, you can go ahead and assign the task that way and hit send task to complete it. And that pretty much covers all of the functions that are going to be found within the clinical tasking tab. Stay tuned for videos covering these other 3 tabs. Thank you very much for your time.